Statin drug side effects. What are they? And what are the other things that you should be equally concerned about concerning a statin drug? Coming right up. Hey, I'm Dr. Rasan with Get a Healthy Body. And if you'd like to truly master health by understanding how the body really works, make sure that you subscribe and hit that notification bell so that you don't miss anything. So we're going to talk about statin drug side effects, and this is a request from Walter, the musician. I recently did a long video on cholesterol, and we covered a little bit of it, but I wanted to expand on some of the mechanisms of the side effects, and talk about why we really need to understand how all this works. Here are some of the most commonly recognized side effects, things like liver damage and muscle damage. And of course, your primary muscle is the heart. There are problems with memory, concentration, and depression. Cholesterol is very important for the brain. There is pain and peripheral neuropathy. There are sleep problems, sexual dysfunction, and fatigue, and these are just the main reported ones. But the mechanism behind that is that there's a guaranteed thing that happens. It reduces the amount of CoQ10. It's a very important enzyme that's vital for energy production in mitochondria. And where do you need it the most? You need it in the organs that use the most energy, which are your liver, your heart, and your brain. Pretty important organs. This is all based on something called the mevalonate pathway, and you don't have to understand these words, but I just kind of put them in there so that you know that there's something going on. So HMG-CoA reductase, that's an enzyme involved in producing mevalonic acid. And then there are a couple of intermediaries that are not important at all, that lead up to something called farnyl pyrophosphate. This, in turn, becomes squalene, which is a greasy substance that the body uses to make cholesterol. And then the same substance is also used to make CoQ10. So these two things compete for resources. But when you take a statin drug, the statin acts on this enzyme and inhibits it. A chemical substance that interferes with something in the body is called a poison, and that's essentially what these things are. By blocking this enzyme, you're stopping this entire pathway, and therefore your body is no longer able to make the same amount of precursor for cholesterol and CoQ10. If you watch that bigger, longer video that I made on cholesterol, you understand that cholesterol is not a stupid mistake. The body doesn't go through all this trouble to make something harmful. It makes the exact right proportions and amounts of LDL and HDL cholesterol of all the different sizes, depending on what's going on in the body, depending on what the needs are to repair inflammation and provide precursors to hormones, and all these different things. It's a very fine-tuned mechanism. If you eat less cholesterol, your body makes more because it's an essential nutrient. Your brain is 60 to 70% fat, and 25% of that is cholesterol. Again, that's not a mistake. It's an essential nutrient. So when we interfere with the production of this enzyme, we're not just interfering with one essential nutrient called cholesterol. We're also shutting down energy production by interfering with the production of CoQ10. Now, if we just go back to this list and look at liver damage, muscle damage, heart memory, concentration, and depression, most of those issues arise because the brain needs both cholesterol and CoQ10. It needs cholesterol as building blocks and precursors, and it needs CoQ10 to make energy. 95% of the energy in your body comes from the oxidation of fuel with the help of oxygen. If you don't have CoQ10, you're going to reduce that amount of energy production. Again, your brain, heart, and liver use the most energy because they're the most metabolically active organs you have. So when you interfere with the building materials and energy production, you get damage in all these vital organs, these essential organs that provide essential functions. But here's the thing to think about. Even if you don't have a side effect, even if you don't notice some symptom, are you better or worse off? If your body has to have something and you interfere with the production of it, are you better or worse off? Worse off, of course. So what that means in terms of every medication is that the mechanism is to interfere with a pathway in the body with metabolic function. If the body is trying to do something, it's not by mistake, it's doing it on purpose. By interfering with the mechanism, we are interfering with something the body feels is essential to do. In every case, you're worse off, whether you get a noticeable symptom or side effect or not. When you interfere with the body, when you reduce something that the body has to have, then you're worse off. That's something to keep in mind. Of course, there is always a time and place for medication, but it's for life-saving purposes, not for metabolic and lifestyle imbalances. The way to correct this, we talk about in length in the other video, but the main things to do are to get some exercise, reduce sugar and carbohydrates, and avoid things that create inflammation and insulin spikes. If you enjoy this sort of content, then make sure that you subscribe and hit that notification bell, and please share this information with as many people as you can, because there are tens of millions of people on these drugs who are developing liver, heart, and brain problems as we speak. If they can understand that they just need to shift their lifestyle just a tiny little bit in some cases, and not really suffer, it's not about deprivation. It's just knowing the sound, innate choices to make to improve those body functions naturally.